back within 2 weeks. In other reports, Coordinating Minister of Health and Social Welfare, Professor Ali Pate, has highlighted 2 major initiatives under President Bola Tinubu's healthcare reform to include maternal mortality, reduction in innovation and initiatives project, as well as National Emergency Medical Service and Ambulance Scheme. Maternal Mortality Project, according to the minister, offers vital support to pregnant women, while National Emergency Medical Services focuses on providing emergency transport for women in remote areas. Professor Pate, who stated this during his visit to Sokoto State's governor, also informed him about the $1 billion project, HOPE, which aims to enhance healthcare infrastructure and workforce. He highlighted National Health Fellows programs, which is in its final recruitment stage, as one that will help improve healthcare quality for Sokoto residents.
In Sokoto State, maternal mortality is much higher than the national average. Same thing with child mortality. I think the rate of 977 per 100,000 live births is something that we can work on. Of the 172 local governments in Nigeria that we have identified that represent more than half of all mothers dying in the country, 4 of them in Sokoto State. And I think working together hand in hand under your leadership and the team that you have put in place, we can crush that rate of mothers dying needlessly in our country. Beyond what we are doing through the sector-wide approach, through the primary healthcare agency, through health insurance to ensure that mothers get free emergency obstetric services. Those are things that we are contributing, but we know that you are also contributing. So with what the federal government is doing and what you are doing, I think we can make further progress.
The minister commended Sokoto State Governor for his strides in the healthcare sector and urged him to expand recruitment for community-based health workers, while calling for improved tracking of polio immunization efforts to ensure all children in Sokoto receive life-saving vaccines.
The emergency medical system and ambulance scheme is another effort that we're putting in place so that emergency transportation is available to our population. Deploying skilled birth attendants. Your Excellency, I know that you are working very hard to revitalize the primary healthcare centers in this country. You know, within the context of BHCPF, federal government has revitalized some primary healthcare centers, but you are also doing more to complement what the federal government is doing. From our side, we increased the direct facility financing to 244 accredited primary healthcare centers in Sokoto State.
In response, Sokoto State Governor Dr. Ahmed Alihu acknowledged the state's achievements in primary healthcare delivery and immunization coverage, while highlighting the state's efforts in strengthening healthcare infrastructure.
We made a very remarkable achievement, particularly in primary healthcare delivery and immunization coverage, as well as effort in persistent transmission of circulating vaccine-derived poliovirus type 2 in the state. Ladies and gentlemen, government has strategically convened a meeting with all the relevant commissioners, local government chairmen, director of health, traditional leaders and the rulers to formally assign them a performance mandate to better result in our immunization coverage.